Today we will read about obstruction of the upper respiratory airway, that is obstruction during sleep, otherwise called sleep apnea. A variety of respiratory disorders are associated with sleep, the most common being sleep apnea syndrome. Sleep apnea syndrome is defined as cessation of breathing apnea during sleep. Pathophysiology. Sleep apnea is classified into three types: obstructive, central, and mixed. In obstructive, lack of airflow due to pharyngeal occlusion. In central, simultaneous cessation of both airflow and respiratory movements. Third one, mixed, a combination of central and obstructive apnea within one apneic episode. The most common type of sleep apnea syndrome is obstructive sleep apnea. Clinical manifestations: excessive daytime sleepiness, frequent nocturnal awakening, insomnia, loud snoring, morning headaches, intellectual deterioration, personality changes, irritability, impotence, systemic hypertension, dysarrhythmias, pulmonary hypertension and cor pulmonale, polycythemia and enuresis. Repetitive apneic events result in hypoxia and hypercapnia, which triggers the sympathetic response. As a consequence, patients have a high prevalence of hypertension and an increased risk of myocardial infarction and stroke. Medical management. In mild cases, the patient is advised to avoid alcohol and medications that depress the upper airway and to lose weight. In more severe cases involving hypoxemia with severe CO2 retention, that is hypercapnia, the treatment includes continuous positive airway pressure or bilevel positive airway pressure therapy with supplemental oxygen via nasal cannula. Surgical procedures: uvulopalato-pharyngioplasty. Uvulopalato-pharyngioplasty may be performed to correct the obstruction. As a last resort, a tracheostomy is performed to bypass the obstruction if the potential for respiratory failure or life-threatening dysarrhythmias exists. The tracheostomy is unplugged only during sleep. Although this is an effective treatment, it is used in a limited number of patients because of its associated physical disfigurement. Pharmacology therapy. Treatment of central sleep apnea also includes medication. Protriptyline, given at bedtime, is thought to increase the respiratory drive and improve upper airway muscle tone. Medroxyprogesterone acetate and acetazolamide have been recommended for sleep apnea associated with chronic alveolar hypoventilation, but their benefits have not been well established. Administration of low flow nasal oxygen at night can help relieve hypoxemia in some patients, but has little effect on the frequency or severity of apnea. Nursing management. The patient with obstructive sleep apnea may not recognize the potential consequences of the disorder. Therefore, the nurse explains the disorder in language that is understandable to the patient and relatives, and symptoms, that is daytime sleepiness, to the underlying disorder. The nurse also instructs the patient and family about treatments, including the correct and safe use of oxygen if prescribed. Thank you.